The story of four women, each traversing a distinct phase of the intricate and ever-evolving journey called life. Priyanka, a 32-year-old mother nursing her 3-month-old daughter, finds herself caught in the merciless grasp of fate. Married to Rahul after 8 years of unwavering love, their journey had been one of deep companionship, laughter, and shared dreams. Now, that very journey stands on the precipice of an unbearable tragedy. Diagnosed with stage 4 breast cancer, which has insidiously spread to her brain, she has been handed a prognosis too cruel to bear mere months of survival. Rahul, her devoted husband, is drowning in a sea of anguish, unwilling, unable to accept the inevitability. She, the love of his life, his college sweetheart, the one with whom he had built his entire world. How could destiny be so merciless? The weight of helplessness crushes him as he rushes from one hospital to another, desperately seeking a miracle that refuses to come. There are moments when the pain overflows and he collapses into inconsolable sobs, cursing the heavens, cursing himself. How could he not come to know? How can he let her go? Suzanne, a 43-year-old, an adoring wife, a devoted mother, a tenacious career woman who thrived in the chaos of ambition. The soul of her family, she worked relentlessly to carve out a future for her children. Her daughter, Maria, dreams of touching the stars, yearning to become an astronaut. Her son, Stephen, still finds comfort in her embrace. The lower back ache that she had dismissed as nothing more than the aches of an overworked body turned out to be due to stage 4 breast cancer, already gnawing away at her bones, leaving her incapacitated, bedridden, stripped of all independence. Even the act of relieving herself is a humiliating ordeal. The pain is relentless, but worse is the knowledge of what is to come. She prays not for a miracle, not for time, just for release, an end that is swift and merciful. Maria and Stephen, their young hearts, too fragile for such devastation, stand helplessly, unable to comprehend why their vibrant, powerful mother is now just a shadow of herself. David, her husband, is haunted by a single unbearable thought. How did he not come to know? How did he fail to see, to act, to protect her? Aishwarya, a 58-year-old, the unwavering pillar of her home, radiated warmth. Her ever-smiling presence, the quiet force behind her husband Akshay's tireless ambition. Just 2 weeks ago, she had returned from a cherished tradition, joyfully sealing her eldest son's love story, welcoming Meher as a soon-to-be daughter of the house. She had laughed off the small stumbles, blaming them on her usual clumsiness. Then came the morning. She could not rise, left half of her body paralyzed, betraying her, and in that cruel moment, her world shifted forever. The diagnosis stuck like lightning. Stage 4 breast cancer, its ruthless grip tightening around her brain, stealing her away piece by piece. Akshay and their sons stand in silent devastation. Their home, once echoing with her love, now heavy with the unbearable weight of impending loss. Akshay drowns in helplessness, his mind tormenting him with the same relentless question. How did this happen? How did he not come to know? Could he have done anything to stop it? But fate is deaf to regrets, and all he can do now is watch as the light of his life flickers, fading into the darkness beyond his reach. Mumtaz, a 64-year-old lady, was the epitome of warmth, a devoted grandmother, a nurturing soul whose life radiated love and tranquility. For some time, Mumtaz had been struggling with breathlessness, an ailment she brushed aside until one day few droplets of blood stained her cuff. What seemed like a minor affliction soon unraveled into a devastating truth. She was diagnosed with stage 4 breast cancer, its merciless grip extending to her lungs. Amir, her husband, unable to fathom the cruel twist of fate that threatened to wrench away the very essence of his existence. He had envisioned these years as a time of companionship, a period of quiet joys spent in her presence. She was the pulse of his routine, the comforting sight that greeted him every morning with a steaming cup of tea, the ceaseless melody of her chatter, the affectionate musings about their children, the laughter-infused gossip that filled their home. And now, as he stood at the verge of an unimaginable loss, his soul trembled at the thought of life without her. The mere notion of waking up to silence, of existing in a world where her laughter no longer echoed, was unbearable. His heart cried out in anguish, pleading, "Oh God, take me with her." And then, like a relentless tide, the same tormenting questions surfaced again and again. Why? How did this happen? How did he not come to know? Could I have done something to prevent it? You may not have yet grasped the staggering magnitude of this silent catastrophe. That every single day, over 1,800 women perish under the merciless grip of breast cancer. How many among them were a Priyanka, a Suzanne, an Aishwarya, a Mumtaz? Women brimming with dreams, laughter and love. Lives not merely lost but stolen. Their stories severed mid-sentence. Their future erased before they could unfold. And this is only one side of the tragedy. Please pause and consider the unseen grief. How many Rahuls and Akshays stand before funeral pyres, their trembling hands lighting the flames that consume not just the bodies of their beloveds, but their own very souls. How many Davids and Amirs kneel before fresh graves, their hearts shattered beyond repair, condemned to a lifetime of aching silence. According to World Health Organization, in 2022 alone, 2.3 million women heard the words that changed everything. You have breast cancer. Of them, 670,000 did not live to tell their stories. That is, 1,835 women lost every day. One life extinguished every few minutes. Every 14 seconds, somewhere in the world, a woman's fate is sealed by a diagnosis she never saw coming. And these numbers are not plateauing, they are surging. An unstoppable catastrophe. The Globocan Project, a global cancer research initiative under the International Agency for Research on Cancer, that provides estimates by cancer site and sex in 185 countries, including India. A harbinger of grim truths. Its 2022 data states that around 25% of breast cancer cases in India were in women less than 50 years of age. And this warns us of an even darker future. By 2040, India is set to become the cancer capital of the world. And the horror does not end here. A recent study spanning multiple nations, including India, has uncovered a devastating 79% surge in cancer cases among individuals under 50 years of age in the last 3 decades. A staggering and ominous shift. This is an unfolding apocalypse, and at the forefront of this ruthless onslaught is breast cancer. No longer a disease of the elderly, but a predator stalking younger women, striking them down in the prime of their lives. If this trajectory remains unchallenged, there will come a time when every family will bear the weight of this disease. This is just not data. This is devastation measured in numbers. For behind each number lies a shattered family, a grieving partner, a child deprived of his mother's love, and a love story left incomplete. And yet, the world watches, unmoved, unaware, or worse, indifferent, until tragedy knocks on its own door. Mahima Chaudhary was diagnosed with breast cancer at 48, Chavi Mittal at 42, Hamsa Nandini at 37, Hina Khan at 36, and Tahira Kashyap at 35, and Barbara Mori was mere 29 years old when this merciless disease struck. Even the wife of a beloved cricketer, Navjot Singh Sidhu, was not spared. These are just not names. They are ominous warnings. Breast cancer does not discriminate. It does not pause to consider age, social status, or faith. It does not care whether you are rich or poor, famous or unknown. Once believed to be a threat after the age of 50, this silent executioner is now preying upon younger women, creeping into their lives in their 40s, even in their 30s and 20s, without warning, without mercy. Do you see it now? This is no longer a distant fear. It is an imminent, relentless predator that roams freely, striking without prejudice. The question is no longer who is at risk, it is who is next. If you are a woman listening to this, have you ever truly considered that your risk of developing breast cancer is just as real, as immediate, as indiscriminate, and just as imminent as that of any other woman of your age? That you are equally vulnerable as Priyanka, Suzanne, Ashwarya, or Mumtaz, women whose lives were forever altered by this ruthless disease. If this thought has never crossed your mind, please pause and reflect now. Because the numbers do not lie. They are echoes of impending doom. The statistics are no longer distant figures. They are warning bells tolling for every doorstep, every home, every woman. Breast cancer is no longer confined to the whispers in hospital corridors. It is knocking louder and louder on the thresholds of every household, inching closer with each passing day. Are you prepared to face this truth? Or will you wait until the knock is on your door? And if you are a man listening to this, I implore you to understand that the woman you cherish, the one for whom you would defy the heavens, your beloved, your life's very essence, is just as vulnerable to breast cancer as any other woman of her age. Imagine, if you dare, the sheer terror of standing in Rahul's, Akshay's, David's, or Amir's place. God forbid if the unthinkable were to happen, if your life partner were to be diagnosed with this merciless disease. Can you fathom the helplessness, the despair, the crushing agony of knowing that you, her protector, her pillar of strength, stood powerless as fate tore her away? Could you endure a lifetime of regret, tormented by the unbearable weight of inaction, whispering desperate prayers, wishing you could turn back time, hoping in vain for a chance to rewrite fate? Are you willing to live in the torment of helplessness and drown in guilt, forever haunted by the question, could I have done something? Like so many Rahuls, Akshays, Davids and Amirs? Or would you rise as a guardian of love, steadfast and resolute, a man of unwavering honor, his spirit fortified by love and duty? Would you not choose to stand with unshakable pride, your heart swelling with the knowledge that you did take a step to fight for her? Would you rather not live with your head held high, unburdened by remorse, liberated from the shackles of regret, knowing that she remains by your side, safe, treasured and flourishing, not because of mere fortune, but because you choose to fight for her, because your love was not passive, not fragile, but fierce, boundless and relentless, unwilling to watch her slip away when you had the power to stand between her and harm. If this is what you want, then my dear friend, Brahams Protocol, a revolutionary genesis, is for you. Brahams Protocol is a radical approach that heralds an epoch of change in preventive healthcare, intertwining medical science with the profound dimensions of love and responsibility. For the first time in human history, in the entire world, a groundbreaking revolutionary shift in breast cancer screening has been conceived. Brahams Protocol, my dear friend, is the dawn of a new era, one that redefines the very framework of early detection by entrusting this crucial responsibility to none other than the soulmate, and that is you. This trailblazing paradigm, wherein every lover not merely bears the ultimate and unwavering responsibility of shielding his beloved from the perils of breast cancer, but also fortifies and empowers himself physically to wage an informed and resolute battle against this formidable nemesis. Brahams Protocol is not just a concept, it is a manifestation of my relentless pursuit to bridge the chasm between helplessness and action. As for the skeptics, until this very moment, across the vast and the infinite expanse of the cosmos, there is no doctrine, no ideology, no principle or methodology of such profundity and transformative potential and such an audaciously potent weapon against breast cancer has ever been conceived or realized. The Brahams Protocol is a selfless offering, a system given freely to all, born from the relentless pursuit of a singular truth, that no man should ever have to stand powerless as the love of his life slips away into the abyss of breast cancer. If you choose to disregard it, you are forfeiting the chance to shield your beloved from the harrowing, merciless breast cancer. The choice is yours, the burden is yours, and so will be the consequences. For when that loss comes, it brings with it an unrelenting torment, guilt, pain, regret. Forgive my bluntness, but cancer does not negotiate and grant second chances. It strikes without remorse, it devours, it destroys, and it leaves behind nothing but sorrow. Before I give you the Brahams Protocol, let me tell you why so many women are dying of breast cancer. A question that demands not just an answer but deep introspection. We know that death from cancer occurs when the disease reaches its most advanced merciless stage, stage 4. The staggering toll of 6,70,000 lives lost unveils three critical factors that underpin this crisis. Number one, the predicament of late diagnosis. The reason is both alarming and tragic. In its early stages, breast cancer remains a silent intruder, progressing unnoticed. The second fact is the harsh reality of treatment limitations. Breast cancer, when detected in its early stage, is entirely curable. It can be eradicated, offering patients a renewed lease on life. However, once it progresses into an advanced stage, it ceases to be curable and instead becomes a disease that only can be treated but not cured. And number three, the overwhelming financial burden. The exuberant cost of treatment is another devastating barrier. Many patients, despite their will to fight, succumb not to the disease itself but to the economic burden it imposes. Amongst these three factors, the most decisive and the transformative one, the factor that holds the power to reverse the fate of millions, is early detection, as nearly 80% of breast cancer patients present in stage 3 or 4. So late diagnosis, my dear friends, is the greatest killer, and this is precisely where Brahams Protocol will make a difference, as now Brahams Protocol is not merely an innovation but an urgent, inescapable necessity. A necessity that may very well decide the difference between love preserved and love lost forever. Another aspect is, why are we not able to diagnose breast cancer in the early stages? Despite remarkable advancements in medical science, the early detection of breast cancer remains an elusive goal. And you must understand that there are four primary reasons behind this challenge, each rooted in biological, physiological, and socio-cultural complexities. And the first most important factor is that the deceptive silence of early stage breast cancer. In its initial stages, breast cancer is largely asymptomatic. It offers no warning signs, no discomfort, no visible changes. The silent progression makes early diagnosis nearly impossible without proactive screening. Secondly, the very anatomy of breast cancer conspires against early detection. The breast is primarily composed of soft, fatty tissue, which is naturally pliable and loose. This anatomical feature allows a tumor ranging from the size of a glass marble to that of a lemon to remain concealed within the breast tissue, undetectable to the naked eye. Third factor is the hormonal influence. Throughout a woman's cycle, the natural ebb and flow of hormones cause cyclical changes in the breast size, density, and sensitivity. What may seem like normal tenderness during one phase of the cycle could, in reality, be an early stage malignancy going unnoticed. And the fourth factor is the unspoken barrier, social and cultural stigma. Even in the era of boundless information and so-called open dialogue, a deep-seated reluctance persists, which still prevents women from openly discussing breast health, even among fellow women and even with their own soulmate. This silence comes at a devastating cost. By the time a woman overcomes a hesitation and decides to see a doctor, her cancer has often advanced to an incurable stage. Now, as you can grasp the harrowing severity and the urgency of this crisis, a pressing and unavoidable question must be coming to your mind. Can I, as an individual, defeat this lethal disease in any practical manner? And the answer is a resounding yes. But achieving this victory necessitates two fundamental paradigm shifts. Firstly, we must reconceptualize the very essence of love. And secondly, integrate Brahams Protocol into your lifestyle. So, the first thing that we need to do is to redefine the definition of love. You must be wondering why I, Dr. Colonel Brahamjit, a medical oncologist, is speaking to you about love instead of medicine today. In our country, today also, the majority of marriages are arranged marriages, wherein the parents and the relatives play the primary role in selecting a spouse for an individual, and only a fraction of marriages are so-called love marriages. For we Indians are a special breed of humans. We are definitely unique. For unlike the rest of the world, we not only fall in love with total strangers whom we marry, we often not only vow to fulfill all our duties as a spouse, also go to any extreme possible to live up to our commitments and spend our lives together till the very last breath. We learn to love after marriage, and isn't it amazing and surprising that most of our arranged marriages survive our lifetime? For most of the married and men in relationship, expressing love and affection and fulfilling their responsibility translates into simple gestures such as talking sweetly, sending romantic messages on WhatsApp, or sharing romantic Instagram reels, looking after her worldly requirements such as buying her expensive gifts, traveling with her to exotic locations, dining at the choice of a restaurant, and spending a major chunk of their hard-earned money on her. In fact, Indian men are unparalleled when it comes to poetic declarations of love. We are perhaps the only breed of men in the world who promised to pluck the moons and stars for our loved ones. In no other culture does love find such grand theatrical expression. And when it comes to romance, every man fancies himself an embodiment of Shah Rukh Khan's charm, Hrithik Roshan's intensity, Salman Khan's charisma, or Ranbir Kapoor's allure, all in one, effortlessly personifying love in all its possible forms. Yet, when faced with one of the life's most crucial responsibility, the duty of safeguarding his beloved from the most notorious of all cancers, breast cancer, we fall behind. We excel in expressions of love, but in one battle that truly matters, we hesitate, are unaware or unprepared. If you are a man listening to these words, allow me to ask you a question. When was the last time you ensured that your wife or your lady love underwent a mammogram for breast cancer screening? Have you ever paused to consider that the woman you cherish with all your heart and soul, the woman you adore, the one who completes your world, could fall prey to this monster, which would not only incapacitate her but kill her? You dream of spending a lifetime by her side, of cherishing your golden years filled with laughter, memories, and love. But have you ever asked yourself, if she were to be diagnosed with breast cancer, would she even be there to walk beside you in your old age? We now stand at the most critical and defining juncture in our relentless battle against breast cancer. The imperative assimilation of Brahams Protocol into the very essence of our existence, its integration into the every fabric of our daily lives. To don the mantle of a medical oncologist is to bear an immense and solemn burden. Each passing day, I stand as a mute sentinel to the paralyzing dread, the abyssal despair, and unrelenting helplessness that ensnare the patients and their kin. Yet, despite every arduous endeavor, I am confronted with an inescapable truth: the intransigent limitations of modern medical science. For all the technological marvels we have unveiled, for all the groundbreaking therapies we have devised, and for all the sophisticated armaments with which we combat disease, one immutable reality persists, and that is the patients are diagnosed when it's already too late. A single tormenting question echoed through the corridors of my consciousness, refusing to be quelled. How, within the confines of my finite capacity, could I hope to mitigate an infinite affliction so boundless in its devastation? Amidst this anguished contemplation, a singular vision coalesced, an approach unencumbered by the constraints of cost, accessibility, or complexity. For the first time in the cosmos, through the unwavering faith of those who have entrusted me with their hope, and the divine beneficence that has guided my hand, and I, through the resolute and unfaltering love of my wife, a love so infinite in depth and so profound in its sanctity that words falter in its description, I forged something truly transformative, a revolution by itself, humbly offered by a son of the soil, a veteran of the Indian Army, and above all, a man who refuses to acquiesce to the inevitability of suffering. A protocol designed not to solely avert untimely loss, but to fortify the immutable bonds of companionship, ensuring that no heart should ever be burdened with a wrenching lament, if only we had known sooner. Thus, the Brahams Protocol was conceived, a vision wrought from suffering, tempered by an unwavering resolve, a manifestation of devotion, a legacy of unassailable protection for you. Thank you. Jai Hind. Life is an intricate tapestry woven with trials and triumphs, yet the irrefutable truth remains. Challenges far surpass victories in the fabric of our daily existence. However, there is no doubt that with our meticulously devised strategic framework, we can rise above these adversities and claim the triumph that is rightfully ours. Amidst all the obstacles we face, one stands above all, a challenge so profound, so urgent that it demands our immediate attention: the protection of our cherished life partner, our beloved, our soulmate, from the looming peril of breast cancer. The Brahams Protocol is a groundbreaking revolution, a transformative paradigm that, for the first time in the history of humankind, grants you the power, the knowledge, and the resilience to confront this battle head on. My mission is clear and resolute: to empower every man in India with the mastery of Brahams Protocol, equipping them with the indispensable tools and wisdom to shield their life partner from the grasp of this merciless disease. The time to act is now, because every moment counts and every life deserves to be fought for. Before I delve into the intricacies of Brahams Protocol, BHP, I want to take a moment to sincerely express the pride and admiration I feel for you. Yes, you, my friend, your heartfelt understanding of the importance of protecting your life partner from breast cancer, along with your earnest desire to educate yourself about BHP, is truly remarkable. It speaks volumes about the depth of your love. More than just a responsibility, this reflects your boundless compassion, your dedication, and the commitment you hold towards the well-being of the one you cherish. It is a beautiful testament to the kind of person you are. So what actually is Brahams Protocol? At its core, the Brahams Protocol is elegantly simple, yet profoundly significant. It is a twofold approach comprising of inspection, that is to see, to look, and palpation, to feel. This meticulous yet intimate process demands no elaborate medical apparatus, as no sophisticated equipment or clinical setting is required. All it needs are merely your eyes and hands, a private, comfortable environment, and definitely the informed consent of the lady. This entire examination requires less than 10 minutes, yet within this span lies the potential to alter destiny itself. The responsibility of conducting this assessment falls upon the life partner who, through unwavering attentiveness, transforms into both the protector and the sentinel of his beloved's well-being, and that, my dear friend, is you. Love, often thought to reside in the heart, is in truth orchestrated within the vast complexities of the brain, a delicate symphony of hormonal cascades and neurochemical interactions. Oxytocin, testosterone, endorphins, dopamine, and norepinephrine, these potent neurotransmitters create a wave of euphoria, passion, and deep emotional connectivity, forging an inseparable bond between two souls. So the question arises, when is the right time? It is a commitment beyond a single instance, and therefore there is no rigid schedule. But for optimal efficacy, it is advised that in menstruating women with a regular cycle, the ideal time would be 3 to 4 days after the cycle, when hormonal influences on the breast become minimal. For menopausal or women with irregular cycles, a fixed date, perhaps a birthday, an anniversary, or any significant recurring moment, should be chosen each month. So now let's come to the first component of Brahams Protocol, and that is inspection, that is to see. My dear friends, the power of perception. The eyes only see what the mind knows. That is, the eyes discern only that which the intellect has been conditioned to recognize. And this fundamental exam constitutes the cornerstone of a medical profession, encapsulating the essence of diagnostic acumen. I am sharing this principle with you today with the objective that after my comprehensive exposition of the pertinent concepts, your cognitive ability will be markedly enhanced and you will be able to detect with precision the critical signs necessary for the early detection of breast cancer. So whenever you get an opportunity, observe with a keen sense of concern and interest. An impression can be done under two scenarios. Number one, during hugging, cuddling, embracing, and daily intimate moments of companionship. With every embrace, every tender moment shared in the quiet solitude of companionship, there exists an opportunity, a chance to observe, to discern, to protect. Look beyond the surface, attune yourself to the subtle nuances, and observe for any kind of asymmetry between the breasts, such as change in the contour of one breast, levels of the nipples, any discharge from the nipple, or any visible lump, and pay attention even to the most minor irregularities. Within them may lie the earliest whispers of an unseen battle, and let this not be merely an act of observation, but an unwavering commitment to protection. It is crucial to recognize that the majority of breast cancers in the early stages remain asymptomatic, often developing silently without causing any overt discomfort. When symptoms do emerge, they are often non-specific and subtle, making them easy to be overlooked. Thus, no complaint, however minor, should be disregarded. A fleeting discomfort, an unexplained tenderness, or an unfamiliar sensation all demand attention, for they may serve as the earliest harbingers of a malignancy yet to be diagnosed. The second scenario is during intimacy. Observe, given the dynamic anatomical nature of breast tissue, certain abnormalities may only become evident in particular positions due to gravitational redistribution or muscular contraction, and you need to look for, number one, any asymmetry in the contour, the size and shape of the breasts. Breast asymmetry may be physiological, However, a new onset disproportion, especially if one breast appears noticeably larger or distorted, warrants concern. Secondly, look for any puckering or dimpling, These retractions in the cutaneous surface, that is skin of the breast, occur due to the infiltration and contraction of Cooper's ligaments, which are a network of suspensory fibers that maintain breast architecture. Malignant involvement of these ligaments leads to localized adhesion and fibrosis, exerting an inward traction on the overlying skin, resulting in dimpling or a tethered appearance. Thirdly, any redness or orange peel-like skin. This pathognomonic feature is a result of dermal lymphatic obstruction by the malignant cells, leading to lymphedema and cutaneous thickening. The exaggerated prominence of sweat gland openings interspread with an edematous dermis produces a stippled orange peel texture, medically termed peau d'orange. Fourthly, any engorged veins. The presence of dilated, prominent veins that you may see over the breast may indicate an increased vascularity due to tumor angiogenesis, a hallmark of malignancy, where cancer cells secrete pro-angiogenic factors like VEGF to sustain rapid proliferation, or obstruction of venous drainage by a growing tumor mass causing collateral vein dilatation. And now, the fifth component, we look for the nipples. And the nipples, we need to look for, number one, any discharge. Discharge can be bloody, that is red blood tinged, or serosanguinous, that is blood with a fluid, clear fluid, or serous. Serous is watery nipple discharge. Now these are obvious signs. In a recent study, 30.3% of women with bloody nipple discharge and 17.6% with serous discharge were subsequently diagnosed with breast cancer. So please do not ignore this fact. Ductal carcinoma in situ, DCIS, and invasive ductal carcinoma, IDC, types of breast cancers frequently involve the lactiferous ducts, that is the milk ducts, leading to pathological secretions, and any discharge is a matter of great concern. So second thing you have to look for is any recent contraction or retraction or inversion of nipples. Please note that half of all inverted nipples are due to congenital causes, that is their presence since birth. But any recent or new onset or unilateral, that is on one side only, inversion suggests that an underlying ductal malignancy or is periductal fibrosis due to neoplastic infiltration, that is, it is associated with cancer. Thirdly, any asymmetry of the nipples. Any uneven nipple positioning or deviation could be due to an underlying cancer that pulls the nipple inwards, creating asymmetry. And number 4, eczema. A disease known as Paget's disease of the nipple causes eczema-like changes on the skin of the nipple and the areola. This is a relatively rare condition but is associated with a very aggressive breast cancer. And now the fifth component which you need to see is the areolas. One should look for any discoloration, nodularity, or localized edema which may indicate an underlying pathology, particularly when associated with adjacent nipple abnormalities. So this was the inspection part of Brahams Protocol. Now we come to the most critical component of Brahams Protocol, palpation. Feel, that is the tactile examination of breast tissue. It is designed to detect subclinical masses, textural changes, or deep-seated abnormalities that may evade visual detection. This step should be conducted integrating tactile exploration with the 7 cardinal steps and principles of effective palpation. Now, I'm going to give you a brief overview by enumerating the 7 steps of palpation, which are the heart and soul of Brahams Protocol. The aim is to make you connect with each step, therefore grasp the entire picture. And then I will describe each step and the scientific principle in detail, because many of you would be interested to know and understand the how, why, and what is the scientific rationale behind each of these cardinal steps. This will make the video a bit lengthy, but as you know, Brahams Protocol is for life. So let's start. Number 1, use the first 3 fingers, the index, middle and ring fingers held together for palpation. Number 2, use the flat pads of the 3 fingers. Number 3, how to palpate, feeling the breast tissue accurately using counter pressure and pressure modulation. 4th, use of circular finger movements at every spot. 5th, screening the entire breast using one or all the 3 methods that I am going to tell you today. 6thly, do not ignore the axilla, that is the armpits. And 7th is examination of the nipple areolar complex called the NAC. So these are the 7 steps and principles which are the most cardinal factors responsible for giving us the diagnosis. Let's start with the first step, that is use the first 3 fingers, that is the index, middle and ring, held together, not separately. Now you must be thinking, why these 3 fingers? Not 1, not 2, not 4. So the concept is, for understanding this principle of optimal tactile sensitivity, we need to know the breast anatomy. The human breast is composed of mammary lobules and lactiferous ducts interspread within a fibro-fatty stroma with Cooper's ligaments providing structural support. That is, in layman words, the breast is composed of mammary glands. Now these mammary glands are conical in shape, they are lengthy, long and conical, and they have the ducts attached which lead directly to the nipple, and therefore you have 2 components. One itself is the mammary glands and these ducts which are supported by a soft fat tissue, the whole structure being held in place by wires which you call the Cooper's ligaments. Now the point to understand is that because of the presence of these ligaments, because of the presence of these mammary lobules which are conical, which are lengthy, long and ovoid in the shape, they give an inherent nodularity to the breast. Now this inherent nodularity has to be understood, for it can lead to false positives and false negatives when identifying lumps in the breast. That is, a false positive occurs when a test incorrectly indicates the presence of a condition like a tumor lump when it is actually absent. That is, it was the inherent nodularity which was identified as a tumor. So that's a false positive. A false negative occurs when a test incorrectly indicates the absence of a condition which actually was an underlying breast cancer when it is actually present, and that is the tumor is misunderstood as the inherent nodularity of the breast. Therefore, to overcome this fiasco, you have to use the first 3 fingers, and this is based on both anatomical and biomechanical scientific principles that optimize the detection of pathological changes within the breast tissue, and these are: number 1, optimum pressure distribution and tactile sensitivity. The application of 3 fingers ensures a broader distribution of pressure across the breast tissue. This configuration enhances the mechanoreceptor activation, especially of the Pacinian and the Messiner's corpuses, which are essential for detecting variations in tissue consistency. In contrast, using 1 or 2 fingers localizes the pressure to a smaller area, reducing the sensitivity and spatial resolution necessary for identifying small and deep-seated nodules or indurations. Number 2, there is a greater surface area coverage and efficiency. Obviously, the involvement of 3 fingers allows for the greater surface area to be palpated per unit time, enhancing the spatiotemporal mapping of tissue irregularities. This technique minimizes the likelihood of missing subtle masses or structural distortions, particularly those that might be obscured when palpation is conducted with insufficient coverage. Third, enabling depth variation and layered examination. The use of 3 fingers enables us a graded application of pressure, facilitating the examination of different depths of tissue, as it allows the triple pressure technique, where the superficial, the intermediate and deep palpation are executed sequentially to assess the epidermal, glandular and retromammary areas respectively. Now, this layered approach is critical for detecting lesions at various depths, ensuring that both the subcutaneous, that is just below the skin, and deep-seated abnormalities are identified effectively. And the fourth scientific concept is optimization of biomechanical stability and precision. Now, from a kinesthetic and neuromuscular perspective, the three-finger technique provides a more stable and controlled movement pattern, reducing involuntary tremors and enhancing proprioceptive feedback. This stability improves your ability to differentiate between the normal glandular tissue, that is, the inherent nodularity, and the pathological changes such as any cyst, any fibroadenomas, or malignancies. So this method therefore integrates the neurosensory, the biomechanical, and the anatomical principles to enhance diagnostic precision. So now we come to the second step, or the second cardinal principle, that is, use the flat pads of three fingers together and not the tips. Repeat, not the tips. The palpation is to be the flat pads and not the tips. Breast palpation requires an optimal balance between sensitivity and specificity to differentiate normal glandular nodularity from potentially malignant masses. The three-finger pad palpation method is based on neurophysiology, biomechanics, and clinical science. So, neurophysiologically integrating the mechanistic underpinnings of sensory integration. Sensory integration takes place in the brain, that is the brain's ability to receive, organize, and use sensory information from the body and the environment to enable effective and purposeful responses. Now, mechanoreceptor activation, that is a specialized sensory receptor which detects mechanical stimuli like touch, pressure, or vibration, is triggered, causing the receptor to send signals to the brain. And the third aspect is the proprioceptive feedback. The neural signals our brain receives from specialized receptors, that is the proprioceptors in our muscles, joints, and tendons, providing information about body position, movement, and the force exerted during movement. Now, ensure that palpation is conducted accurately, effectively, and comfortably, maximizing the diagnostic potential while minimizing distress. Now, I explain to you the neurophysiological, biomechanical, and optimization of sensory processing in brief, so that you are able to comprehend the science behind this protocol. Number one is the neurophysiological basis, the sensory receptors and signal overload. The human fingertips are densely innervated with specialized mechanoreceptors, particularly Meissner's corpuscles. The Meissner's corpuscles are densely located here, which are low threshold, rapidly adapting mechanoreceptors responsible for detecting fine textures, vibrations, and minute surface irregularities. Now, these corpuscles are most concentrated in the distal phalanges, that is the fingertips, and they play a critical role in detailed tactile discrimination. When only the fingertips are used, an excessive influx of afferent sensory inputs occurs, overwhelming the brain's somatosensory processing centers. This leads to hyperdetection of normal glandular nodularity, making it challenging to differentiate the physiological glandular nodularity versus the disease-causing nodularity. And the brain receives an excessive number of tactile signals, making it difficult to construct a clear perceptual map of the underlying structures. This reduces diagnostic accuracy, increases the likelihood of both false positive, that is mistaking a normal nodularity for disease, and false negative, failing to detect deeper pathological lesions. Whereas the pads of the fingers have a higher density of Merkel's discs. Now, this is a type of slow adapting mechanoreceptors specialized for pressure perception, shape recognition, and sustained touch sensitivity. Merkel's discs allow for precise spatial discrimination without excessive sensitivity to minor glandular nodules, making them ideal for detecting deep-seated abnormalities such as hard fixed irregular masses suggestive of malignancy, and areas of tissue thickening due to ductal or lobular changes, and regions of even altered elasticity which indicate invasive cancer. So this was the neurophysiological basis. Now, the biomechanical concept of optimized pressure distribution. The flat pads approach distributes pressure evenly across a larger surface area, preventing localized tissue indentation which can distort findings. Then there is the role of somatosensory processing. The primary somatosensory cortex S1 in the postcentral gyrus of the brain is responsible for processing the tactile inputs from the fingers. Now, the three-pad finger method optimizes this process. Now, how does this optimize this process? It's very interesting. So, firstly, it causes reduced neural overload. Minimizing excessive mechanoreceptor activation allows the brain to focus on detecting deeper structural anomalies rather than being distracted by normal glandular texture. Number 2, enhanced spatial resolution. Now the combined input from three fingers works together. It provides a broader and a more cohesive representation of tissue architecture, and this helps in distinguishing benign cysts like soft, mobile from malignant ones which are firm, fixed, irregular in shape. And the third point is proprioceptive feedback integration. Now, using these three finger pads allows for a detection of tissue elasticity, fixity, and depth analysis, which is critical in differentiating between various pathological conditions. So now we come to the third important step and the cardinal principle, that is to palpate the breast tissue accurately using counter pressure and pressure modulation. To correctly feel for a lump, we need to understand another scientific concept, and that is a solid mass, that's the tumor, can only be effectively appreciated when pressed against a firm structure. This scientific principle of counter pressure is essential for optimal mass detection. But the breast itself lacks a rigid internal framework and has no hard fixed surface. Therefore, trying to feel for a lump would be like finding a needle in a haystack. So this is where our knowledge of human anatomy comes in. So we know that the breast rests on the ribs and that from the chest wall, and this is obviously a firm structure. Thus, the ribs, the intercostal muscles, they serve as a firm, immobile surface against which the breast tissue can be compressed to feel for a lump. This technique of counter pressure enhances tactile discrimination by providing a stabilized base, preventing the lump from moving freely within the soft tissue of the breast. And without this firm counter resistance, a deep-seated lump may remain undetected, camouflaged by the surrounding tissue elasticity. Now comes another important scientific aspect of pressure modulation. As we all know, the breast tissues do not have a uniform density and thickness. Near the clavicle, that is the collarbone, there is less fat and tissue. And as one goes down, the glands, the connective tissue and fat increases, increasing the size of the breast. Now we use this knowledge and try to feel for a lump by gently pressing the breast tissue by three finger pads against the chest wall, applying varying degrees of pressure. You cannot have the same pressure here, here and here. So you apply varying degrees of pressure to ensure comprehensive examination. That is, use light pressure where tissue density is less, such as near the clavicles, that is the collarbone. Slightly increasing the pressure, that is moderate pressure as you come down, and finally firm pressure in and around the nipples. Please remember, one has to balance pressure and sensitivity. Excessive pressure may cause discomfort and tissue deformation, making it difficult to accurately assess any mass. And insufficient pressure may miss a deep-seated, fixed or infiltrative cancer lesion. So this will need some time and effort on your part, but gradually you will become a master in this step. Remember, this palpation technique improves with practice as the fingers develop proprioceptive memory based on pressure for distinguishing between soft, mobile, well-defined masses which are often benign and hard, irregular, fixed masses which are suggestive of malignancy, that is cancer. So we have covered 3 cardinal principles. Now coming to the 4th one, and the 4th is use of circular finger movements at every spot. You need to screen the entire surface of the breast, but before you do that, you have to know the correct method as to how to feel. Now, before you proceed any further, it is crucial for you to understand the correct scientific biomechanical and pathophysiological method to maximize the accuracy of palpation-based tumor detection. And that is, when you are palpating the breast, use a rotatory circular motion either clockwise or counterclockwise depending on your individual convenience. Now you must be thinking, why this circular motion? In order to comprehend this concept, you should know that this specific technique is grounded in scientific principles of tumor morphology and tumor growth dynamics, tissue elasticity and tactile sensory mechanics such as enhanced edge detection, compensation for non-uniform tissue depths, optimal utilization of proprioceptive feedback for tumor discrimination, and optimization of shear force for deeper masses. So let me start by telling you briefly about tumor growth dynamics. You see, a tumor does not grow in a uniform spherical manner. Rather, it proliferates irregularly. It's a 3D structure. It grows in all 3 dimensions, infiltrating adjacent structures in a heterogeneous pattern. To conceptualize this, instead of imagining a tumor as a smooth, round mass, think of it as a ginger root with multiple irregular projections and varying depths of infiltration. Tumor cells do not expand symmetrically. Rather, they exhibit variable growth velocities in different directions, creating nodular extensions, spiculations, and uneven margins. So, malignant tumors are characterized by stellate, that is star-shaped, spiculated or irregular borders, which may be difficult to perceive with linear palpation strokes, and therefore circular palpation allows for multi-directional contact, improving the ability to detect small irregular tumor extensions. So this was a very important concept which you need to understand. And now the biomechanics. A rotatory motion allows enhanced edge detection by the fingertips as one sweeps across all possible protrusions of a tumor, improving the spatial resolution of border detection. Further, since tumor infiltration depth varies, the circular motion ensures that pressure is exerted at different angles, allowing for multi-dimensional assessment. Now, we know that proprioceptors, that is mechanoreceptors, they play a crucial role in tactile differentiation of textures and densities, and circular palpation engages multiple mechanoreceptors, including the Meissner's corpuscles, which are sensitive to light touch and texture changes, as I told you, the Pacinian corpuscles, which respond to vibration and deeper pressure stimuli, and Ruffini's endings, which detect skin stretch and slow deforming pressure. So another important aspect is that a tumor embedded within deeper glandular lobules can be obscured by overlying fatty and connective tissue layers. The circular motion creates a shear force, allowing one to displace superficial tissues while simultaneously exerting deep pressure, improving deep lesion detectability. Therefore, unlike linear palpation, which may apply pressure unevenly across tissue layers, circular motion distributes pressure dynamically, ensuring that all tissue depths are assessed. It improves sensitivity to hardness differences, which is a key feature in distinguishing between a malignant, which is a firm immobile structure from benign, which is a soft and mobile lesion. It reduces the likelihood of false negatives, especially for flat infiltrative tumors that do not form discrete nodules, and the rotatory motion compensates for tumor irregularities, tissue depth variations, and mechanoreceptor engagement, significantly improving the detection of an early stage malignancy. Therefore, we need to perform this rotatory motion at every spot of the breast we palpate. So now we come to the fifth important principle of Brahams Protocol, and that is comprehensive breast screening. That is screening the entire breast to maximize the accuracy and reliability of breast palpation for early tumor detection. It's crucial to systematically screen the entire breast surface rather than employing a haphazard approach. So a well-structured method significantly will improve sensitivity, that is your ability to detect true positives, and specificity, that is ability to exclude false positives when identifying a potential breast mass. So before we palpate, we must know what are the anatomical boundaries of the breast. Where does the breast start from? So if you must understand that the superior border, that is the upper boundary, is the clavicle. This is the clavicle, this is the collarbone. This serves as the superior limit. Inferiorly, that is the lower boundary, the inframammary fold. This is the inframammary fold where the breast meets the chest wall. This marks the lower limit. Medially, that is the inner boundary, is the sternum. This is the chest bone, and this sternum, the chest bone, serves as the inner boundary, ensuring that medial breast tissue is adequately screened. And lateral, that is the outer boundary, the mid-axillary line. This is the armpit, the middle of the armpit. So the breast does not end at the beginning of the armpit. It goes up to the middle of the armpit. This is very important. The mid-axillary line is a line drawn, an imaginary line, vertical line passing through the middle of the armpit. This is called the mid-axillary line, is the lateral limit. Now this ensures that the tail of Spence, this is a part of the breast that extends into the axilla, is examined. To ensure that no area is overlooked, you must employ a structured pattern for systemic palpation, and this is what I am going to tell you today. I am explaining 3 scientific methods. You can use any one or all of them as per your comfort and convenience. Now all the 3 have nearly the same sensitivity and specificity when trying to find a breast lump. The first method is the clock pattern, that is the circumferential approach to breast palpation. The clock pattern method is based on a circular progression similar to reading a clock face. Now this circumferential approach ensures uniform coverage and enhances detection accuracy. So first step 1 is you visualize the breast as a clock face. The dial of your watch or that of the alarm clock you have at home. So imagine this is the complete clock. As you imagine this is a complete clock, the central point is the nipple. Now this is the face of a clock dial. The breast as a flat circular clock face with nipple at the center. This is the pivot point where your needles are supposed to be placed, and assign clock positions to different sections of the breast. So 12 o'clock is the superior most portion directly below the collarbone, the clavicle. 3 o'clock is the lateral portion towards the outer side near the inside the armpit. 6 o'clock is the inferior position near the inframammary fold. 9 o'clock is the medial position closest to the sternum. So this is the first step. You visualize that you are looking at a clock. You have demarcated different areas as per the timing that we see. Now the second step is initiating palpation from the outermost periphery. That is, begin palpation at 12 o'clock position. Apply light, medium and deep pressures sequentially. You can move clockwise or you can move anti-clockwise depending on how you want to go, how you're comfortable with the hands. So as you can see, I am going in this direction. I am palpating using the 3 finger pads, and I am applying pressure in a rotatory manner, and I am going completely outside, bigger circles, right, covering the entire breast. And as I come back to the 12 o'clock position in a gradual concentric manner. Now step 3 means, as we come towards, now we are going to gradually reduce the radius. We're going to gradually reduce, that is from the outer bigger circle, we keep coming inwards. So now my fingers are moving at a smaller radius, and I'm going across, complete another circle, completely another circle, right, again back to the 12 o'clock position. And now again the third time I go again in a circular manner, going around the nipple. Finally I'll come to the closest to the nipple, that is at the end point. Now after, as I said, after completing the first rotation, we keep decreasing the radius and repeat the circular palpation, moving inwards toward the nipple from outside to inside. That is, by decreasing the radius, we are covering the entire area of the breast. And finally we end at the nipple, and then we repeat the same process at the other breast. So this is a very simple method, very simple. You can go clockwise or anti-clockwise depending on your convenience. Just remember, start from the outside, come to the inside. Now there are certain scientific advantages of the clock pattern. Number 1, it ensures a systemic and complete coverage because you're palpating from the outermost to the innermost zones. Secondly, adapts to the tumor growth pattern, as malignant tumors often originate in the periphery and they extend towards the center. Hence, starting from the outermost boundary improves the detection accuracy. And number 3, it maximizes edge detection via radial palpation. So when you're doing this palpation along clock positions, this enhances the edge of the tumor, which enables better differentiation between benign and malignant masses. Coming to another very interesting method of examining the complete breast, and my dear friend, this is called, I have named it the Pisa pattern. The Pisa, yes, you heard it correctly, it is the Pisa pattern. Now this is also a scientifically structured approach for comprehensive breast palpation. This method ensures there is tactile sensitivity and you have uniform breast coverage, reducing the likelihood of missing deep-seated or irregularly shaped masses. To perform this method effectively, we first need to understand the biomechanical and the anatomical perspective, and that is, the breast is a 3-dimensional structure. It's a glandular organ composed of lobules, ducts and adipose tissue. Now all these are arranged in a radiating pattern from the nipple outwards. Now you can imagine, visualize all these, the ducts, the lobules in fat tissue are radiating outwards from the nipple like the beams of a light radiating outward 360 degrees from the point of origin. This is the point of origin. The nipple is the point of origin and the beams of light are radiating outwards in a 360 degree pattern, and because of this intrinsic radial organization, the Pisa pattern mimics natural breast anatomy, making it an efficient and scientifically valid palpation technique. Now in this method, we visualize the breast as a circular structure, that's your Pisa, divided into multiple Pisa slices. You can divide it into 4 Pisa slices, or you can divide it into 6 Pisa slices. So a slice will start from one edge, come to the center, in the periphery again to the center, so it will form a slice, it will be a wedge shaped triangle, wider on top and narrowing and ending culminating at the nipple. Now each Pisa slice is a wedge, has to be examined separately. Now here we move in a linear direction from periphery towards the nipple, not like the first one in the clock we went circular. From here we will go wedge by wedge from one edge of the wedge to the center. So first step, visualize, imagine the breast as a full circle divided into multiple triangular slices of a Pisa. The nipple serves as the center point and the wedge divisions radiate outwards. So once you imagined, you start your palpation from the outermost periphery. Now you can place the pads of your 3 fingers, again middle index about half an inch below the chest clavicle, and using a gliding motion here, move in a straight line towards the nipple. As you do it once, again go back to start again from reposition the fingers at the outer edge of the adjacent wedge. Keep going, keep going, keep going, and now I have completed examination of one wedge. Step 3, going to the other wedge, I can either go clockwise or anti-clockwise sequentially. Do not miss a quadrant. So you can restart. If I want to start from this side, I can restart. This is the wedge I will be covering in this method. I'll start on this side. I'll go here gently, circular motion, again start, and reach here. So I cover 2 and I can go in a complete circular fashion covering all the areas of the wedge. Continue this process until all wedge sectors have been covered. Do not forget adjusting the pressure for depth differentiation as I explained to you earlier. Now after completing the entire examination method, extend palpation to the underarm area, that is the armpits. Please do not forget this. I'll be covering this in one of the other principles. Now there are certain signs. Second advantage is it enhances the edge detection for asymmetrical tumors. Now the malignant tumors often grow asymmetrically with irregular and infiltrative borders, as I showed you the ginger, and radial gliding methods enhance this ability to detect masses that blend into surrounding tissue, improving diagnostic accuracy. Thirdly, it improves tumor localization in different breast quadrants. As the breast, when we discuss in the medical terms, we divide it into 4 anatomical quadrants: upper, outer, upper, inner, lower, outer, lower, inner, and most of the cancers are seen in the upper outer quadrants. So this PISA pattern ensures that each quadrant is thoroughly examined, reducing false negatives. So 2 methods, and now coming to the third method. This is again a very interesting method, and this method is the mesh pattern. Mesh pattern, yes, the mesh, that is vertical and horizontal glide technique. This is a gliding technique because you have to go vertical and horizontal. Again, is a systematic method of breast palpation that allows for complete coverage of the breast tissue, including both the superficial and deep layers, and is structured, biomechanically optimized, and neurophysiologically precise approach. Now, this method is particularly useful for detecting abnormalities along the natural ductal pathways, as well as assessing changes in breast density, skin texture, and nodularity. And it can be specifically practiced when the lady is lying down on her back, is the scientific concept. Now this method differs from the earlier 2 methods in 3 ways. Firstly, here you imagine that the breast is divided by multiple straight lines, both vertically and horizontally, forming a mesh like the mesh on your window against mosquitoes. And our 3 fingers will move on these lines up and down, covering the breast from top to bottom, that is below the clavicle to the inframammary folds, and in to out, that is from the sternum to the armpit. This way covering the entire breast. Secondly, here, instead of lifting the fingers from one point of palpation to the another, we have to maintain continuous contact with the skin, as if not breaking the integrity of the straight line, using a gliding motion. And thirdly, we do not use the rotatory motion as we did in the above 2 methods. Now this technique is again based on maximizing sensory perception, ensuring uniform tissue displacement, and biomechanical efficacy. So what is the first step? We place our fingers just below the clavicle, that is the collarbone, on either the innermost or the outermost aspect of the breast, depending on your convenience. Now start moving the fingers in a straight line, linear path, advancing in a controlled manner from above to below across the entire breast surface, from the clavicle to the inframammary fold. Step 2, Once you have reached the inframammary fold, again go up, restart just adjacent to the where you started earlier. For example, if you started the outermost, you can go slightly inside. If you started from the innermost, you can come out slightly outside, and again the same straight line you are feeling with the 3 fingers. There is sliding motion, gentle sliding motion using your finger pressures, and this is how this is supposed to be done. Now step 3, once you have completed from upwards to from the clavicle to the inframammary folds, we start from the upper end of the sternum, which is the chest bone. We start from the upper end of the sternum, and again we move our fingers from outwards towards from inwards towards the outward, that is towards the mid-axillary line. Same motion, gliding motion, and once you reach the outermost aspect of the breast, lift your fingers, restart from the sternum, and this time just below the point from where I explained to you earlier, just below that point. So you're basically going in a horizontal fashion. So at the end of the process, you are done vertical and you done horizontal like a mesh. You have covered the entire surface of the breast. Now the scientific basis and advantages of this technique are that it ensures, number 1, optimized tactile sensitivity, that is the gliding motion minimizes finger pressure variability, preventing tissue distortion. And now studies on haptic perception confirm that continuous skin contact enhances detection of low contrast irregularities such as early stage tumors. Number 2, reduction of false negative results. That is, unlike the before left palpation which are using in the above 2 methods, which can miss subtle lesions, the linear glide technique ensures constant sensory feedback, reducing the likelihood of overlooking small deep-seated abnormalities. Number 3, enhanced detection of mobile and fixed masses. Now, mobile masses are example fibroadenomas, which are benign lumps. They glide independently under the fingers, whereas fixed masses are mostly invasive cancers. They resist movement, making their detection more reliable. 4th advantage, improved biomechanical ergonomics. That is, the technique reduces our fatigue by eliminating unnecessary vertical pressure adjustments. It provides a more natural hand movement, making it easier for you. Now remember, most of the tumors arise in the outer aspects of the breast. So please be extra cautious here. You can use any or all the 3 methods of palpation, and please remember to palpate both the breasts, and if you feel any abnormality in one breast, confirm it and compare it with the other breast. Take your time and don't rush. Now coming to the 6th cardinal principle, do not ignore the axilla or the armpits. You must know an important biological fact that around 75% of lymph that is found in the breast drains into the axillary lymph nodes. For you to understand, lymph is a clear watery fluid that circulates throughout the body, and it circulates in the lymphatic system. It carries white blood cells, nutrients and other substances, and is a part of our body's immune system, as it helps fight infections and cancers by carrying lymphocytes, which is a type of white blood cells. And nodes, a lot of people ask me what are nodes. Please understand that nodes, which is actually lymph nodes, are the fortresses of the army of the body, and they play an important role in fighting infections and cancer. The lymph nodes of the body are connected with each other through vessels which we call lymphatics. These are actually the highways through which our army marches to different parts of the body to fight disease. The axillary lymphatic network plays a very pivotal role in immune surveillance and oncological spread. This acts as a primary conduit for cancer cell migration from the breast to different parts of the body. Now, breast cancer is a systemic disease with a predilection for early lymphatic dissemination, and given that approximately 75% of the lymphatic drainage from the breast flows into the axillary lymph nodes, the axilla serves as a very critical sentinel site for metastatic involvement. So, thorough palpation of the axillary region is an indispensable component of any breast examination, as lymphatic metastasis often precedes the clinical detectability of a primary breast tumor itself. The axillary lymph node basin comprises approximately 30 to 40 lymph nodes, which are stratified into different anatomical groups based on their spatial orientation within the axilla. Now, these include the anterior, that is the front pectoral nodes; posterior, that is the back, that is subcapsular nodes; central nodes; apical on the top, supraclavicular nodes; and lateral, which is on the arm, the humeral lymph nodes on the lateral wall of the axilla. Now, how to feel for the nodes in the armpit? To feel for the lymph nodes in the axilla, you have to ensure a systemic and thorough assessment. We visualize the axilla as an inverted cup. This is the axilla, it's an inverted cup. The walls represent the anterior, the posterior, the medial and the lateral boundaries of axilla. The roof of the axilla as the base of the inverted cup signifies the apical and the subclavicular lymph nodes. Now, the technique for palpation remains the same. We utilize the pads of the index, middle and the ring finger. We apply gentle firm pressure, systematically moving from superficial to deep tissues, and palpate in a circular motion, as lymph nodes are often small, round and mobile, and they require dynamic tactile engagement for effective detection. So we proceed from wall to wall, starting from the front, that is the anterior wall, that is the pectoral nodes. We press gently against the chest muscle. Press gently against the chest muscle. This is, if you're visualizing it like this, this is the pectoral muscle sweeping in a vertical motion to detect enlarged or firm lymph nodes. Then the back, the position of the hand will change. The back posterior wall, inner, then the inner, the middle wall, and then the outer, the lateral wall, and finally the roof for the apical nodes. Please be careful, don't use too much of pressure, it can cause a lot of discomfort. Now, what you must be thinking is, what do you have to feel in the axilla? See, please understand that normal lymph nodes are so small, they are round, and they are painless and freely mobile that you will not feel them at all. Whereas cancerous nodes will be palpable, that means they will be enlarged. They will also be painless, but will be progressively enlarging, and they are hard and they may be stuck together. It's called matted lymph nodes. Now, this matting takes place because the tumor infiltrates, leads to the fibrotic entrapment within the surrounding tissue, and they usually, remember, on one side, that is one side nodes if you feel, and not on the other side. Probably you're dealing with a cancer which is spread from that breast to the lymph nodes. So please remember that the axillary lymph node involvement often precedes the detection of a palpable breast mass, making it one of the most important and the earliest indicators of malignancy. And the extent of axillary node involvement is one of the strongest prognostic indicators in breast cancer, directly correlating with disease progression, metastasis and survival rates. A comprehensive axillary examination is not merely an adjunct to breast palpation. It is an essential diagnostic maneuver that significantly enhances the early detection and staging of breast cancer. By integrating this systemic wall-to-wall assessment, scientific palpation techniques and anatomical visualization inverted cup strategy, you can maximize your ability to detect malignant changes at the earliest, that is, in the most treatable stages. Therefore, by prioritizing armpit evaluation, that is the axilla, one is not only detecting cancer early, but also potentially saving a life, which is a testament to the power of your love, your knowledge and Brahams Protocol. So now coming to the last principle and the step of Brahams Protocol, that is examination of the nipple and the areola, together called NAC, nipple areolar complex. The NAC is an integral component of the breast. It comprises specialized exocrine glandular structures and sensory innervation. Given its direct anatomical connection to the lactiferous ductal system, the nipple serves as a crucial diagnostic site in breast cancer screening. Additionally, the areola, which contains Montgomery glands, plays a key role in lubrication and protection. Now, the pathological changes in the NAC include abnormal secretions, which I told you during the part of inspection, retraction, ulceration or nodularity, and may indicate malignancy, particularly ductal carcinoma in situ or Paget's disease of the breast. The nipple houses around 15 to 20 lactiferous ducts, that is the milk ducts, which converge and open at the nipple's surface, which facilitate milk ejection during lactation. Since the majority of the breast cancers originate in the ductal epithelium, that is in these ducts, nipple examination is crucial in identifying malignancies associated with pathological nipple discharge or structural changes. So, nipple palpation is done for evaluating presence of any discharge and structural abnormalities, and the technique is very simple. Use your thumb and the index finger, gently compress at the base of the nipple, applying light progressive pressure towards the center. Please be gentle. Remember to do it very gently and not to cause any pain or discomfort. And what do you need to see for? Look for any discharge. Especially see if there is a discharge, what's the color, the consistency and volume. Examine for nipple inversion, retraction or deviation, any ulceration, crusting or eczematous changes. And now for the areolar palpation, for detecting subcutaneous nodularity, again the same concept, using the pads of your 3 fingers, gently palpate the areolar region in a radial or circular motion, applying progressive but comfortable pressure. Identify any subcutaneous, that is just below the skin thickening, nodularity or masses, and examine for asymmetry in the Montgomery glands, as any unilateral swelling or induration may be due to cancer. Please remember that approximately 10 to 15% of breast cancers present with nipple abnormalities. Making detailed palpation of the NAC is a crucial diagnostic step. At the end of Brahams Protocol, as we arrive at the culminating juncture of this consequential discourse, an overwhelming sense of duty compels me to impart insights of unparalleled gravity. Insights that I implore you not only to comprehend but to embody with unwavering conviction and resolute purpose. These are not mere intellectual abstractions. They constitute an important aspect upon which the foundation of early detection of breast cancer stands, wielding the transformative power to alter destinies and safeguard lives of inestimable value. I urge you with an unrelenting sense of urgency to integrate these truths into your every thought, decision and action, for their significance extends far beyond the realm of theoretical knowledge, carrying the immense responsibility of saving lives and shaping the course of human survival itself. And these are: number 1, false positive. Please understand, it's a false alarm. Detecting a breast lump can be nerve-wracking, and it will involve a couple of tests to confirm that it is not a cancerous lump. Sometimes a breast lump detected by you may only be a normal mammary gland, a cyst or a fibroadenoma, or any benign condition that does not require any intervention. This experience of a false positive is definitely a nightmare. I agree with you. But you have to understand to get the complete picture. It implies 3 important facts. Firstly, Congratulate yourself because you have become an expert in Brahams Protocol, as now your somatosensory perception and neurocognitive abilities and diagnostic acumen surpass that of a doctor. Secondly, it speaks volumes about your sense of responsibility and your commitment towards the person you hold close to your heart. And thirdly, as you have got the lump evaluated and there is no cancer, you and your lady love can celebrate. Please understand, there are no second chances with cancer. Second carry home thought. Brahams Protocol is a non-invasive breast cancer screening tool, not a replacement for clinical and radiological evaluation. Please understand, Brahams Protocol is a screening modality and not a diagnostic procedure. It has been designed to facilitate early detection of breast abnormalities in an intimate and familiar environment by a non-medical person. And that, my dear friend, is you. So that Brahams Protocol is not a substitute for professional medical evaluation, and it does not replace the gold standard imaging modalities such as mammography and ultrasonography of the breast, which are essential for comprehensive breast cancer screening and diagnostic confirmation. Third thought which I want you to think about: we need to restructure the breast cancer screening guidelines. The international guidelines on breast cancer screening and also the Health Ministry of India have recommended routine annual mammographic screening starting at 40 years of age. However, an ocean of evidence emerging from epidemiological studies suggests an increasing incidence of breast malignancies in younger women. In fact, the Globocon data of 2022 has shown that in India, more than 25% of breast cancer cases were less than 50 years of age. Further, studies have clearly shown that these cases which occur in younger women manifest at more advanced stages, suggesting more aggressive disease biology and with a higher grade histopathology as triple negative breast cancer, a subtype of which is now more prevalent and is associated with rapid progression and poorer prognosis. In fact, if you recollect, Mahima Chaudhary, Hina Khan, Tahira Kashyap, Chavi Mittal, all are living proof of breast cancer cases in less than 50 years of age. In fact, few of them are less than 40 years of age. What are we waiting for? I strongly feel that initiating annual mammographic screening from age 30 would allow for the early identification of microcalcifications, ductal carcinoma in situ and invasive tumors, improving overall survival outcomes. Using this platform today, it is my humble submission to each and every one of you watching this video on Brahams Protocol. Please motivate and ensure that your spouse, your girlfriend undergoes mammography and ultrasound of the breasts at least once a year, starting earliest possible, irrespective of the age, at least once. This revolutionary thought has to be implemented at two levels. Firstly, at the government level by revising the screening guidelines, and most importantly at an individual level, that is, my dear friend, at your level and also at the private sector level. My sincere request to all the industry leaders and to all women and men at positions of power: as a humanitarian and welfare measure, please initiate a drive as a company policy to provide for annual mammographic screening, not only for the women employees but also for the families of the men you have employed, and starting annual mammography from 30 years of age. Fourthly, breast cancer is not an affliction confined to a particular age group, nor does its potential impact diminish at any stage of life. Global data highlight an alarming cancer incidence among women under 50. It is equally critical to acknowledge that age itself remains one of the most significant risk factors for developing the disease. Scientific evidence unequivocally demonstrates that the probability of developing breast cancer escalates with advancing age. Therefore, Brahams Protocol should not be viewed as an age-restricted practice, but rather as an enduring and proactive measure that should be seamlessly incorporated into every woman's life, irrespective of chronological age. For a husband or partner, performing Brahams Protocol is an act of devotion, a tangible expression of commitment to safeguarding the well-being of a loved one. For when it comes to breast cancer, there are no second chances. Only the power of early detection, the strength of informed action, and unwavering resolve to protect and preserve life. Fifthly, Brahams Protocol is not just a scientific procedure. It is a revolutionary concept, an act of love, a silent promise offered freely. It empowers every devoted life partner to stand as a guardian, a protector of the one they hold dear. You will be glad to know that the best advantage of practicing Brahams Protocol is that we will be able to detect breast cancer in the early stages, that is in stages 1 and 2. And in these stages, the 5-year survival rates are nearly 98% and 93% respectively, compared to the dismal only 22% survival of stage 4 breast cancer patients. Please remember, with each careful touch, it becomes a language of care, a whisper of devotion, seeking to uncover the unseen before it turns into sorrow. Brahams Protocol is based on the solemn notion that no woman should suffer, no love should be lost to time's cruel hands. It is about ensuring that the warmth of her embrace, the light in her eyes, and the laughter in her voice remain untouched by the shadows of fate. And my dear friend, now is the time to embrace this moment and be a part of this revolution. Jai Hind.